Okay, this is the sixth lecture in acute pancreatitis. This is a critical care station in the MRCS Part B exam. Okay, well, I'm Dr. Lazy as usual, and if you want to follow, you can subscribe down. Okay, well, what is the next question? The examiner is going to ask you, what is your management? Okay, and acute pancreatitis is a critical disease, and you are going to manage this patient according to the care or for the critically ill surgical patient. Okay, of course, care for there is some R here. So you are going to care about him with the care for the critically ill surgical patient. What is the care for the critically ill surgical patient? What is the care for the ATLS? What is the care for LDs? It is A, B, C, D, E. If you miss this word, mention A, B, C, D, E, because you have to say it, and here you got the mark. Okay, but you have to follow in your management to the examiner. So number one, you are going to take history. Number two, you are going to make examination, physical examination. Number three, you are going to do labs. You are going to do ABGs, you are going to do bloods will contain the full blood count. You are going to do chemistry, okay, urea, albumin, glucose, all these things should be done. These are your investigations, and now you are going to move to your radiological investigations. You are going to do ultrasound, you may need to do CT here, okay, and according to these things you are going to do your scoring, and according to your scoring, either Glasgow or Ranson's or whatever, you are going to decide if the patient needs to go to the ITU, okay, to be transferred to the ITU, okay. And if you are going to the ITU, you are going to try to insert a central line or CV line, okay, and CV line usually is used for rehydration. Okay, let's call this number 7. Okay, rehydration, because you have too much loss of fluid in the third space due to the pancreatitis, acute pancreatitis. Okay, you are also going to use this in monitoring. You will monitor the patient if he is empty or full or something like that. Okay, and you may use this central line also for total parenteral nutrition. Okay, why? Because you are going to give this patient total parenteral nutrition because you want to rest the pancreas. Okay, there is an alternative now other than this, which is a nasojejunal or NJ tube. Okay, this NJ tube will bypass the duodenum, and in this way you can save the GIT from atrophy and translocation, but many schools are using TP until this moment. Okay, so we have history, examination, labs, radiological studies, scoring. You may shift to ITU according to scoring, CV line for rehydration, monitoring, and total parenteral nutrition. Okay, and definitely you are going to number 8, you are going to manage his pain. Okay, fine. Number 9, you are going to insert the 2 tubes. What are the 2 tubes? It is NG tube, okay, and you are going to insert a urinary catheter. Okay, 1 tube up, 1 tube down. This is for the evacuation and emptying the stomach and GI, and this is for the urinary bladder. Okay, and as you know, this patient will be PO or MBO, nil by mouth or nil per oris, as you like to say it. Okay, you may start to give some medications. Okay, some give octreotide, and please remember this. Okay, octreotide. This is so much statin analog. This will decrease the pancreatic secretions. Okay. Anyway, you may need to give proton pump inhibitors. These are medications. These octreotides here, proton pump inhibitors, to reduce the risk of erosive stress ulcer, or you may need to give antibiotics. Okay. And this is according to the evidence of infection. This is controversial. Anyway, you are going to give medications according to need. Okay, you may need to do, finally, may or may not do ERCP if the suspected reason is a stone, biliary stone. Okay, so these are the steps that you are going to take here. By all means, the patient will be in PO, he should be MPO. Okay, well, so this is the management plan for the acute pancreatitis.